Good morning, everyone. Today is Thursday, June 28th. Thank you so much for joining into our weekly healthcare reform webinars. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department at URL. My duties include overseeing the traditional group health markets, the level-funded, self-funded markets, the reference-based pricing group markets, short-term medical, and as I always say, what is left of the individual markets in the state of Pennsylvania. So I thank you all for joining in. If you are new to this format, questions are encouraged. Goodness knows we have enough to question nowadays, and all these new things coming out, do take some time to dive into and get our arms around. So if you have questions, you can ask them in one of two ways. You can raise your hand icon. It's in the control panel to the right of your screen, or you can type in a question in the question box, and I'll answer that at the end of the webinar. So just with a show of hands, since most of you know I struggle with technology, if you can just let me know if you can hear me and see my screen okay with a show of your electronic hands, I'd appreciate it. Excellent, excellent, excellent. Thank you. All right, so let's get right into the agenda. I don't have a terrible amount today to discuss. We're talking more on the association health plans. There is an article in my newsletter which will come out around 10 o'clock this morning with more details on the association health plans. But essentially, the DOL released the final rules, and they were able to provide these AHPs, association health plans, by changing the commonality of interest requirements. So in a nutshell, that commonality of interest test really means that now it is open to people within the same trade, industry, line of business, or profession, or located in the same state or metropolitan area. And these requirements are separate from the associations whose members operate in the same industry. The final rule also clarifies that the group or association must have at least one substantial business purpose other than providing health insurance, of course. They have to have a board of trustees, a governing board with bylaws, and they also have to make sure that they do not, that they uphold the non-discrimination provisions. Which of course, really brings up another issue, that if you can't deny somebody membership to an association per se, unless they don't meet the requirements of your association, but none of that has to do with health history, past or, anything upcoming. So as a member of an association, by default, they would have access to the health plan, which, unfortunately tends to blow these risk pools up rather quickly. But that one is something certainly that is important to keep in mind. Working owners now are able to get into the associations. They have to provide at least 20 hours per week or 80 a month performing the services that are affiliated with the association. And of course, it is still all subject to state regulation at each state level. And they're saying that the fully insured association health plans may begin to provide coverage as of September 1st of 18. Existing self-insured association health plans that wish to expand under the final rule may have an effective date as of January 1st, and new self-insured association health plans may be formed under the new standards as of April 1st of 19. So this is turning around, or at least proposed to turn around rather quickly. So we'll keep watching it. If anybody works with associations, we do have some technology that could help really streamline the association enrollment process and the offerings. So, keep that in mind while you're working with your association members. Senate is to hold hearings on the rising healthcare costs. Boy, welcome to the party, Senate. Senator Lamar Anderson, a Republican from Tennessee, is the committee chair, and they're going to be looking at a number of things, but the cost of the federal hospital drug discount program, to the administrative burden on doctors drug prices, and much more. So I think that's really great that they've decided to kind of look at this spiraling effect with these rates and see what can be done or can't be done. Senator Anderson goes on to say that that only 6% of the total market is in the individual market, where a lot of the energy has been focused for the last several years. So I believe that this is going to look more at why the costs are rising, if there's anything that can be done, and looking more from the employer group perspective as opposed to individual. So that should be interesting. On to the agenda, the PCORI fees, they are due July 31st. I have a flyer attached, which really, I think, talks very well and succinctly about when the PCORI fees are due, who has to pay them, the circumstances in which PCORI fees are not paid directly by a carrier, and the responsibility of the employer. So I think it's a really great chart for you. It is put out by Prime Pay, and of course the cost per enrollee, covered life, is on the chart as well. If you can't pull that out from the handout on this segment, just let me know and I'm happy to email that out to you. Save the date, upcoming events, of course, our annual Medicare Connections Conference is at Hershey Lodge. Save that date. It's on September 5th. This is very well attended. It's an all-day event, breakfast, lunch, a lot of speakers. The carriers specifically come in and talk to you and give you a preview of what you will be selling in the Medicare market during the annual election period, which starts October 15th. So very timely, and for those in the Medicare market, it's very important. And again, well attended. We get a lot of good feedback on the topics discussed at this event. CPAHU, their Medicare Summit is at the Holiday Inn East. Last week and the week before, the date that they had originally set was September 6th. They have since changed that to September 13th, so please mark your calendars for that. I am not sure of the agenda, but CPAHU does usually put on some good programs. I think this is going to be a good program for them. There is a cost for members and non-members, but I'll have that information for you as we get closer to that date. And I'd say if you are in that Medicare market, you may want to consider attending both. Our event is free, but again, the CPAHU, even with a nominal cost, probably would be beneficial for you to attend both programs. Anyway, let's move on. Highmark, I don't know why I added this, but I thought, it was an announcement that they put out that their financial ratings have been upgraded from an A to an A, from an A minus. Here's an important one. The FFM certification for 2018, the individual selling season, is ending July 18th. That means that healthcare.gov and CMS.gov is pulling that certification. So if you've not certified for the 2018 selling season and you have sold and want compensation, if there is compensation, you need to get that completed by July 18th. On another note, if all of you recall, Highmark does ask for even an additional certification. It's through Litmus, L-I-T-M-O-S, and it's a really short, just a couple checkbox of more or less ethics within the selling of the programs. And if that is not completed in conjunction with the FFM certification, they will retrospectively pull all that compensation. So if you've not done the certification and you want to, and if you've not then done the Highmark additional certification for the under 65 market, let me know, because again, that has to be done by July 18th, and they will pull commissions because they did it last year. Cap Blue Cross just released fourth quarter rates for the 2 to 50 group, so Highmark should be soon. Folks, we are, for all intents and purposes, into fourth quarter. things are going to start getting crazy. You know, again, however we can help, we're here to help and happy to do so. So keep that in mind as well. We talked a little bit about the plan between Buffett, Bezos, and Diamond. They did appoint the CEO. It's Dr. Atul Gawande. I hope I am pronouncing that correctly. The article is in my newsletter, you know, for those that are following the developments. And Dr. Gawande he currently practices general and endocrine surgery at Brigham and Women's Hospital. He's also a professor at the Harvard T.H. Chan School of Public Health and Harvard Medical School. He is director of Lab, which is a Health Systems Innovation Center, and he's also written some books. So it'll be interesting to see how this evolves. You know, there's no magic bullet out there. Costs are costs, and you know, wellness only goes so far. Trying to keep track of who's utilizing the plan or overutilizing the plan or utilizing the plan incorrectly is going to be a daunting task. I certainly wish them luck, but you know, I'm not sure that there's a magic bullet out there that will make these rates go down for any group. So anyway, open discussion, and a thank you all, as always, for joining our forum. If you have questions, you can type them in while you're formulating those questions, or if you want to raise your electronic hand, I can answer those questions live, or you can ask those questions live. But please keep in mind, next week after the 4th, I will not be here. I'm not going to be holding a webinar, so the next webinar is going to be the following Thursday, which is July 12th already. So let's see, we do have a couple questions. When you get to the okay. So Elise mentioned that when I talked about the 4th quarter group rates for Capital Blue Cross being released, it's only the rate grid. They're not able to be quoted yet. So just keep that in mind. And Dave wants the association rules. Happy to send that out. And Nate says, so something as simple as being in the same state now allows you to create an association. Carpenter in Pittsburgh, a lawyer in Harrisburg. No, they either have to be within the same area, you know, same city, if you will, metropolitan area, or the same association, the same duties. I'll send you some information, Nate, but it's not quite as broad as that. At least not yet. Dave says, how do you foresee associations impacting small groups that we have? Would we lose those accounts to a larger broker who represents the association as a whole? It is quite possible if there are association plans being formed out there, and there are, you know, typically that's kind of a direct sale type of thing through the association. So yeah, I'd say that some of your groups that are in trade associations could be vulnerable to you know, moving outside of a shelf product and moving toward an association product. My personal opinion is I'm not a huge fan of associations. I do think that unfortunately, the way that the risk pools are, they tend to blow up and rates go up higher than other more larger risk pools. But again, you know, we'll see how it goes. It is something. At this time, it's not like we set groups up for a 10-year strategy. We're kind of working in 12-month increments, 24 at best. So I'd say they're going to have an impact, at least initially, because they're going to have lower rates. They're going to have something new and shiny. But long haul, that's yet to be determined. I can only go by how they've performed in the past, and they tend to blow up in rates very quickly. Pam says she just missed on the PCORI fees. They are due July 31st, and Pam, I will get that flyer out to you. Nate asks if UPMC is bringing individual plans to Central PA. Yes, UPMC will be bringing group and individual plans to Central PA. We're not sure what that means for pricing, for product, for compensation, but we are certainly keeping an eye on that, and we'll be part of that. So I will, when I have information, I'm happy to pass that on to you. But yes, they are coming east and making big splashes. And that is it. That is all the questions that I have today. As always, I thank you all for joining in. Just remember, I won't be here for the 5th, so no webinar. I hope all of you have a wonderful 4th of July holiday, and certainly a wonderful balance of the week and a wonderful weekend. Thanks so much for joining in. Bye-bye.